Thank you so much, Carla. Welcome, everyone. Appreciate you all joining us today for this webinar. And Carla, thanks so much for putting up our slides. So today we are going to talk about ACRTI in Action, or ACRTI, which means accessible, culturally responsive, and trauma-informed. And so all of the work that we've been thinking about through our National Center, next slide, please, is really rooted in this idea of how important it is for all of us to be thinking not just about how are we trauma informed, which is important for us in terms of the work we do at our National Center, and I'll talk a little bit more about that in a moment. But it's also thinking about how are we holding what we believe to be a solid, sound, trauma-informed approach. How do we pay attention to our advocacy and everything that we've learned over decades of work in our advocacy, things that you all have been deeply involved in, many of you from the beginning. So lots of history in that, and we don't ever want to lose it. We're also thinking about all the other pieces that go into the work. So it's not just that being trauma-informed replaces everything. It's that as we're thinking about what does it mean to provide services and supports and advocacy for people who have experienced trauma, but it's also recognizing that many of us who do this work have experienced trauma, our communities have experienced trauma, the ways that we do or don't experience justice matters deeply in terms of the movement, but also in terms of survivor experience and in terms of the communities we come from. So lots of diversity for us to be thinking about in those ways. In our center, we are focused on training and technical assistance. We have a deep commitment to doing research and evaluation to keep providing work and resources to the field that is relevant, that supports the work that advocates do. We think about policy development and policy analysis so that we can change the conditions and support the field to change the conditions. And we are deeply rooted in public awareness. We are a FIPSA-funded special issue resource center, and the work and the topics and the content of our conversation is not reflective of everything that FIPSA stands for. So I wanted to be really clear in how this is the work of the National Center and the work being shared today as our panelists, and we are FIPSA funded, and also that we are bringing lots of perspectives to the conversation. So thank you all again for joining. Next slide, please. I do want to talk a little bit more about our framework. So at the National Center on Domestic Violence, Trauma, and Mental Health, we are always looking at, as I was saying, this framework that is inclusive of thinking about access. Can everyone get to us? Can we get to folks who need it, need the supports and the advocacy? Are we culturally responsive so that the work we do and the efforts that we provide are that they resonate, that they make sense for folks? And are we adapting things that need to be adapted? Are we holding the communities we serve in mind as we do the work? And the importance of being trauma informed in our approaches. It's understanding the impacts of trauma and the ways that folks show up and why they show up in those ways. And so, again, we have an hour today to talk a little bit about how folks are incorporating this work and this framework into the work that they're doing. And a little bit more to say before I introduce our panelists today is for folks to be thinking about holding all of these pieces at once so that what we have learned over time about trauma and the impacts of trauma is reflected in how we convey information in our advocacy, but again, doesn't replace advocacy. So it's how are we holding all of these pieces together? So in addition to that, we're also thinking about, again, if you're looking at this outside circle, human rights and social justice. so that we are aware and paying attention to, again, policy, broader advocacy, and thinking about the experiences of the various communities that we serve and the impacts of trauma over the lifespan. And so making sure that wherever we can, we're advocating for human rights and social justice for those impacted. And then in our community spaces, always thinking about the cultural and historical context of the people that we're working with at each moment in time. And so we're hoping to convey that in the work we do, in the products we create, in the trainings that we hold. And then when we look at this inside circle, first speaks to how are we holding folks in our hearts? What are we doing with our relationships? How are we centering relationship and connection as a piece of what is so important in the work that we do? So, thinking about how we're holding hope for folks and supporting resilience of those doing the work and those whose experiences we're centering. And also to think about in all of our interactions, both physical and emotional safety. So we're not pushing past the emotional safety pieces and holding each other in mind. No, that's okay. And then everything we do is based in a survivor defined approach. Without the survivors we support, we cannot do what we do. And that we also, in our actions, are not advocating for things or doing things unless it's what each survivor wants for themselves. So, those are all the pieces that we're holding together in this framework. Go ahead to the next slide, please, and I'll do a quick introduction of our panelists today so that we can hear a little bit about how each of these folks is incorporating an ACRTI or ACRTI approach into their work. So I'm first going to introduce Adrienne Gantz, who is the co-executive director of the New Jersey Coalition to End Domestic Violence. Since 2019, Adrienne has transitioned from direct service as a longtime shelter advocate to being more active in social justice advocacy, focusing on breaking down systemic barriers for survivors, supporting culturally specific organizations, and focus on trauma-focused healing and somatic healing. So bringing this wellness center to all of the work that Adrienne is involved in. She's an active member of the New Jersey Women of Color Task Force and represents the organization in the New Jersey Women's Reentry Commission. So please welcome Adrienne. Our next presenter will be Rose Williams. Rose is the founder and executive director of Harambe Social Services. The agency was founded in 2013 as a response to the lack of culturally specific services for Black African American communities who are victims of community members who are victims of and survivors of domestic violence and sexual assault. Ms. Williams has over 20 years of direct service, advocacy, system change, project development, and management. She has worked on statewide and local level to provide anti-oppression and racial equity training to domestic violence professionals and community-based organizations. And Harambe is deeply rooted in New Jersey's system of supports for survivors of color and has just deep community roots. And I'm so happy to have been able to work with Rose on her journey and sharing part of that. So please welcome Rose Williams. Our next panelist is Lindsay Christopher. Lindsay is the Housing and Economic Justice Program Manager at Violence Free Colorado and has worked there since 2011 with an emphasis on housing stability. She's worked on a variety of roles over years, including housing case management, grant coordinating, and collaboration with community partners to increase housing access for survivors of domestic violence. And then please welcome Lindsay. And David is our last presenter today, our last panelist who is pinch hitting for our panelist who was sick. So David, thanks for joining us. David joined Violence Free Colorado in 2023 after 4+ years working in direct service with survivors of intimate partner violence. David has experience as a child and family advocate, housing manager, community educator. David is passionate about improving the safety and well-being of survivors through ongoing education and advocacy, both statewide and at a grassroots level. So please welcome David Carnes to our panel today. So I'm going to turn this over and ask Adrienne to join us on camera. And the question for you is that over the years, the New Jersey Coalition to End Domestic Violence has worked to incorporate an approach that is accessible, culturally responsive, and trauma-informed. Can you share with us a little about what you've been doing?
Sure. Good afternoon, everyone. I'm grateful to be here and have an opportunity to share about the work that NJCEDV is doing. And as I was preparing, I realized I had a lot I wanted to share, and I definitely wanted to honor Kathy's request to highlight our wellness work and our support to culturally specific organizations. So I will keep it there, but there's a lot of work that New Jersey has done in the past 5 or 6 years to really embrace the ACRTI model. I was wondering how to say that acronym, so I'm glad that you've pronounced it for me. But to be able to to implement that model. And so our work with the National Center actually began relatively soon after I joined the coalition, when we were looking to address concerns about survivors with substance use and mental health needs. We found that those survivors were being screened out from services and often exited from services as a result of finding out that perhaps there was a level of care that they needed that programs felt maybe they could not provide. And so we invited Kathy and Gabriella to come and do a 2-day training for us. And that might have been like the week before COVID, and we were shut down for the pandemic. And as you know, during the time of the pandemic, the needs of survivors were amplified, and we were seeing a lot more survivors presenting with some mental health needs and mental health concerns. And so we've continued to build our relationship with the National Center from that place. And it has really grown, evolved, and expanded, also as our team has grown and evolved and changed. So when looking at and thinking about the ACRTI model, one of the first things I think about and have to acknowledge is the internal work that we had to do in order to prepare for the more outward facing work that we were doing. So it didn't mean that we just only did our work, but we sincerely had to think of how we could balance it, right? So balancing our internal work with our outward facing work, because we didn't want to not practice what we preach, so to speak, where, we're training and providing TA, but we have no clue really how to implement the work. So we had to do it ourselves, and we were able to do that along with consultation from the National Center, Share Time Wisely, Women of Color Network, and other organizations that really helped us to build our framework and really live into our values. And so, like I said, I'll highlight our wellness and our work with culturally specific organizations. And I can start with wellness just by sharing that our former executive director, Pamela Jacobs, who's now with the National Resource Center on Domestic Violence, really did an excellent job in helping us to look at our organizational culture, centering inclusion and belonging and what it means to really do that work and foster trust amongst the team. So surveys, constant evaluation of our policies, looking at our hiring practices to ensure our staff reflected the makeup of New Jersey, and not just from a racial and racial and ethnic makeup, but really looking at folks in their full identities to ensure that they were leading and guiding the work as well, because they represent the communities that we serve. So in doing that work, we were able to look at pay equity. We were able to create work that looked at the experiences of staff across the state in collaboration with our local sexual assault coalition. And from that, we found that due to staff turnover, attrition rates, burnout, and other concerns with some environmental, cultural, workplace related things, that we needed to develop some work around wellness. I will say for this past year, we had a focus on the 8 dimensions of wellness. We were hoping that programs would adopt something for the entire program, but it felt like advocates came and it really provided them with individual tools and resources that they need that they could take back to their programs and implement in their personal lives. And so we definitely want to expand on that work, but I'll share where that started. So Kathy came and did 3 regional trainings for us. And from that, we expanded by hosting monthly Wellness Wednesday sessions. We invited different speakers to come to speak to a particular dimension. We also hosted advocate listening sessions and some follow-up to conclude the year that we spent together, learning about the 8 dimensions and brainstorming ideas for how the work could continue. We were able to cover the cost of 50 subscriptions to Headspace, which would help with some of the support that advocates may have needed, because they were sharing that there was limited time that they had for themselves while at work and outside of work. But on the back end of that, we could anonymously see some of the trends in content that people were utilizing. And from that, we could really pinpoint what some of the needs might have been, where we could address some of the concerns. So it could be like stress management or things related to work. So utilizing that data with our funders as well, so that they could continue to support the wellness work that they were funding us to do. We were also able to provide 20 programs with a small stipend to create and expand their own wellness work. So whether that was, building a wellness room, well, not building it, but creating a wellness space in their workplace, suggesting activities that they could do, or purchasing supplies that staff could use for their wellness. We just wanted to offer something to give them some incentive to build it into their workplaces. And then the last thing we did was develop a resource guide based off of the feedback that advocates shared, so that we could so that programs could implement some of the suggested practices into their workplaces and their work culture. As for the future of that work, we like to continue providing tools and just showing that the work is doable. I think we think about funding all the time, and it tends to limit our ability to be expansive in our thinking about the possibilities. So, we want to continue having the conversation and centering advocate experiences and voices, so that we're able to provide training, technical assistance, perhaps some sample policies for ways to help meet the needs that advocates are raising. So that's that. I could really talk about this all day, so I feel like I'm rushing through, but these are some of the ideas for wellness. And then just really quickly, we'll touch on culturally expansive or culturally specific organization work, which came from really just seeing a gap in services and having conversation about who's missing from the table. Again, not just from a racial or ethnic perspective, but thinking in terms of accessibility and other identities and statuses that exist in our communities, and wanting those community members to be at the table with us. And that also required an acknowledgement of historical harm and repair. So I know that's also part of the ACRTI model. And so we had to have some hard conversations and focus on what it meant to build trust with communities, because the coalition had been complicit in some of that harm and gatekeeping of information from organizations that have been serving their communities for years. And so a lot of them were just receiving funding for the first time, or receiving it from a variety of funding streams. And so we really wanted to step up and hear what their needs were, so that we could support them. And so that was utilizing our resources, funding that we had, to show up and collaborate alongside them, our funders, to provide some nonprofit management support, but then also collaboration with the National Center again to provide training on trauma-informed supervision and again, the ACRTI model and other needs that programs were identifying that they had. So it's been great work. The work is continuing to grow. I'm really proud of the work that we're doing and how far we've come. And before I conclude, I have to extend my thanks and gratitude to Rose Williams of Harambe Social Services because it's her work that has been foundational to New Jersey and the equity work that we are able to do and have been doing and will continue to do. And I definitely stand on her shoulders in this work, and I'm proud to do this work alongside her. So I'm going to conclude my comments there. I can talk about this stuff all day because I really do love these two aspects of our work. So yeah, I look forward to more opportunities to connect and talk. And thank you for the invitation to be here today.
Oh, Adrian, thank you so, so much. And so we'll go right to Rose because her conversation is so relevant to what you were just sharing. So please welcome Rose Williams. And Rose, can you share some about your experience? So you have had, this focus on being culturally responsive, being very culturally specific organization serving the Black community. How does the ACRTI framework or thinking about access being culturally responsive and trauma informed, how has that influenced the work at Harambe?
Well, thank you, Kathy. Thank you for inviting me and to this forum to share the information that I have to offer, and I have to thank Adrian for that wonderful acknowledgement. That's just beautiful. Thank you. Um, Really, the work that we do at Harambe Social Services, we're 11 years old, but the work really stems as an extension of the work that we were doing at the coalition at that time. And so we had recognized the need for culturally specific services in the African American community. That was a services were certainly being offered, but not necessarily culturally relevant or responsive to the needs of the Black community. So we felt that this was a way for us to be more specific. And then also, the work we were doing at the coalition really was without the having that term at the time, the ACRTI model. We were certainly looking at accessibility on all levels, so that where people were physically accessible, logistically and linguistically accessible to the services, because that was part of the gap, that the services were there if you could connect to them. And so we wanted to address that when developing Harambe Social Services. And so we did. And those services are open. We are open to women, men, people from the LGBTQIA community as well. We recognize the need to be inclusive within the Black community, so we do that. We have through the coalition been able to ask access tools that will help us be more accessible to people who are deaf, and that's been like a major thing. And also the same tool does give us some language access. Um, well, we recognize being accessible in all those areas is important, but part of what we wanted to do in providing the services, we think you can be doing a disservice when you try to stretch yourself beyond your capacity. So we have partnered with the two coalitions, the DV Coalition and the Sexual Assault Coalition, as well as others in the community that may specialize in various populations. So that's something that has helped us over this 11 years. And a couple of things. I'm sort of like Adrienne, there's so much to say, but I want to be mindful of the time. Um, we are intentionally trying to focus more on um, our growth as a culturally specific program. We wanted to be grounded, and we grounded ourselves under the principles of Nguza Saba, which are African principles. But for me, and for the many years that I've been associated with understanding what those principles are, I totally believe those principles are such that can carry us throughout the year. But we adapted those principles so that they would relate to survivors. And I'm just going to share one: Ujima, or unity. Our community must be united in the belief that victims and survivors must be valued, embraced, and reassured that their abuse is not their fault. So that itself is trauma informed, it's culturally specific, and it's accessible and saying we recognize that you come with that historical trauma that has trickled down through the generations and then manifest as individual trauma for many, many, many survivors that come through our doors. So, but we wanted to make sure that we are having people who come. It's something that we actually physically give to survivors in their packet of information, that these are the principles that guide the work that we do. And come now working with Kathy, and we were so grateful to have received a scholarship through the coalition, the DV coalition, so that Kathy could come to us and offered us, I'm gonna get it wrong if I say how many sessions it was, but she came just the right time when we felt that what something missing was that the cohesiveness for our staff and to get everybody sort of on the same page and being consistent with how we communicated with each other so that we could be stronger in presenting our message and our services to survivors. So she came in and offered us those sessions that help us to just really be much more understanding of the need to be consistent with how we provide orientation and training to staff, so people come in from the door on the same page and understand, what are your values, what are your principles, but they know from day one, and then consistently sharing that message. And not only that, it's something on paper that we demonstrate those values. And of course, that's always tested, but we do work on remaining consistent. Uh, One of the other things too about what we do in terms of staying trained is we have had several hours of training on the LGBTQIA community from the coalition, as well as the Sexual Assault Coalition, Garden State Equality, have all come in at different times and in different ways, provided additional training for us. Because again, it's not only, the staff evolves and the folks have been trained, but new people come in, and we want to make sure everyone understands that this is a community that's of value to us, and we want to know that they are being respected and offered that same type of service that we would offer anyone else, and that they are welcome. And then another thing that we've done in terms of trauma, you know, we hire all people. We hire staff from all walks and they're all different in their own way, but they have personal lives. They're not machines. And you know, there are so many things that can happen in the course of your time working at an agency. But we wanted staff to know we know you're human, we recognize you're human, and how do we accommodate that and still run a business? And we have offered at times people to have extended PTO that was beyond what we would normally give them. We're a small agency, we don't fall under FLMA. But we know that people just sometimes just need times. So that might be an extra week. Maybe they need it in a couple of hour segments, however that is, but that to offer that with their supervisor having that permission after, you know, some discussion with me and what can we afford in terms of the time, the coverage for this for the survivors, and at the same time offer folks that compassion during a time of need. And so, and I totally feel that that embraces all of the principles of our work that we've had under Kathy. And and so, you know, we're continually looking at ways to improve, to grow, but to stay consistent. Um, but overall, our hope for the future is that we can stay relevant and that we will be sustainable. So I'm gonna stop there because I can go.
Yeah, thank you so much, Rose. And you know, a lot in part what you were talking about is that balance of accommodation and accountability, right? It's
Yes.
how are we holding, we've got all this experience, right? Thank you so, so
Mhm.
much. Wanted to let folks know that Carla has put in the chat 2 resources. One is on this National Center's core curriculum on being accessible, culturally responsive, and trauma informed, and bringing those approaches into your organizations. It's fully scripted. Anyone can access it. You all can use it for training within your organizations, or as coalitions use it with member programs. And then the other is our toolkit on becoming accessible, culturally responsive organizations. So those links are in the chat. There will be some additional resources that we'll post at the end of our webinar and when the
Welcome
slides
to
go
Violence
out.
Free Colorado's Foundations of Act.
It's me.
Oh,
Sorry.
that's okay. And when we get a chance, we'll send all the resources out to folks. I'd like to introduce next Lindsay Christopher. And Lindsay, you want to share some of the ways that Violence Free Colorado has embraced and actually named the ACRTI framework. So we had a long, accessible, culturally responsive, and trauma-informed approaches. Violence Free Colorado said, no, we're calling this ACRTI. And so I will turn it over to you to talk a little bit more about what you all have done with this.
Thank you, Kathy, and thank you for having Violence Free Colorado staff on the panel today. It really means a lot to us, and we love working with you. Hi, everyone who's here today. My name is Lindsay Christopher, the Housing Program Manager with Violence Free Colorado, and I've been with the coalition since 2019. I've been in the DV field since 2011. But when I came to the coalition in 2019, we were not talking about ACRTI at that time. In 2020 to 2022, we had some massive staff transition and staff turnover at the coalition. And some of the staff who left had been there for a significant period of time. So it definitely kind of left us in crisis mode, which I don't think is anyone's favorite place to be. But as a result of this large staff turnover, we spent a significant amount of time in transition, and this was compounded by COVID-19. So not only were we extremely short-staffed in 2019, 2020, and parts of 2021 and 22, but we were also internally navigating all of the pandemic changes, shifting to remote work and supporting our member programs through that unprecedented time as well. As a result of COVID, it really wasn't until 2022 that we were actually able to really dive in as a full new staff and really explore ACRTI a bit more. So in 2022 and 2023, as an internal staff, we really started having what I would call really meaningful conversations at the coalition level, across, including leadership, management, specialists. So none of these conversations were happening in silos. They were all happening as a large staff. And this long transition period was actually really beneficial because it allowed us to be very intentional with our next steps and the steps that we chose to take moving forward. It allowed us a lot of time to address and identify what our strengths were at the coalition and amongst our team, and what were some of the weaknesses or learning edges and growth that we wanted to see in our organization. So we took a lot of time thinking about those things, and also identifying what kind of external support we might need, what kind of support we needed from one another, and how we could grow our team into what we were truly visioning as a thriving team in order to better support our member programs. I think it's also worth noting, given the conversation that we're having, that when I started at Violence Free Colorado, the staff was not very diverse. The majority of the folks identified as cisgender, heterosexual, white women, and I'm happy to say that that is actually no longer the case. In 2022 and 2023, as we started to bring new staff in, and as the former staff, there were a few folks who did stick around, we worked to identify how power had been and maybe was currently being used within the organization, how components of our organizational structure and that power differential was actually resulting in harm, and for lack of a better word, like this stuckness, this inability to kind of move forward towards what we were envisioning as change. And so what we prioritized and identified was the need to heal in community with one another, to rebuild and build trust in one another prior to focusing on anything else that we needed to do at the coalition. We knew that we needed to focus internally on doing this work before we could start with other tasks or other projects, or even bring ACRTI to our members as well. Not to say that we weren't doing some of this work simultaneously. My colleague David is on the panel today as well, and David is going to focus on kind of our external ACRTI focus and our external ACRTI work with our member programs. And I'm trying to stick to the internal side. But as a few folks have shared, I could talk about ACRTI all day. It is infused in all of our conversations, and I'll touch on that a bit more. But we began working, doing this work alongside Kathy and the National Center. Violence Free Colorado began meeting with Kathy monthly. And Kathy really helped us name and identify some of the struggles that she was hearing us talk about, and helped us as a larger staff talk about ACRTI principles and ACRTI components. Kathy shared the different modules in the curriculum that she referenced with us. And we really started using the ACRTI foundation or the ACRTI framework to start healing, to start building trust with one another and as a team, and to really grow alongside each other and grow the coalition. We discussed things like communication styles, decision-making processes, how to give and provide useful feedback, and a lot of other topics. We used ACRTI principles and the conversations that we were having with Kathy to really envision and co-create what we wanted our organizational work culture to look like, how we wanted that to feel, who we wanted sitting at the table. And as we were having those conversations and building out that work culture, we did start to heal, and we did start to grow from past trauma. And we developed some really great strategies and frameworks to keep our work survivor-centered, moving forward, and making sure that we really were creating the organizational culture and the inclusive organization that we wanted. We also explored our values and how that related to the organizational and the work culture that we wanted to co-create, so that we were truly living into our values. They weren't just something that you saw on our website, they really matched up with what you were seeing when you received support or training and technical assistance from the coalition. So as I mentioned, we took time to develop policies, procedures, and practices that supported creating that culture. And we really have been able to create the culture that we want. We are a lot more inclusive and diverse than we were in 2019, but we also recognize that that is an ongoing effort, that ACRTI is not a checkbox, so to say, that being truly ACRTI led and survivor led means it is an ongoing effort. Just some specific examples of some of the things that we were able to develop and implement. We created a whole new system for more inclusive job descriptions, a new hiring process, new interviewing techniques, and created some onboarding strategies that really set folks up for success in their role with the coalition rather than setting folks up for failure in their position once they joined our team. We also, in the spirit of ACRTI, were able to identify funding and create a couple of really exciting new positions at the coalition. So I'm happy to say that we now have an economic justice specialist full-time position and a full-time language access specialist position, which really feeds into our goals of making sure that our work is done through an ACRTI lens. We knew that these were needs or skills that our advocates at our member programs need support with, or they need tools for the folks that they're working with. So that's why we hired these folks. And not only did we spend time virtually meeting with Kathy on a pretty regular monthly basis, but Kathy also very recently spent several days in person with our coalition to help engage in that conversation a bit deeper. Sometimes being remote, there's only so much connection and visioning that you can do while being remote or online. So Kathy came and spent 2 days in person with us, and we were able to really dive deep and have meaningful conversations on our vision, our purpose, and our organizational values. And we're now in the process of continuing that work internally and envisioning how we want to use the conversations that we had and the goals and values that we determined that during those conversations to guide our work as the coalition as we move forward. So just to reiterate, I did want to mention that Violence Free Colorado really infuses ACRTI principles into all of the work that we do. And as a result, it was almost hard for me to sit down and pull out some of this information because to a lot of our staff, we've been so ingrained in ACRTI for the last few years that thinking about accessible, culturally responsive, trauma-informed practices has become a second nature, which is really exciting. We continue to have conversations around how can we communicate with each other, how do we give and receive feedback, and we've continued to invest in external consultants that help guide our organization and help us examine how we provide information to members in a better, more accessible, culture responsive, and trauma-informed way as well. David will touch on some of that in just a few moments. But as the coalition, we know that a lot of DV organizations in the state look at us to model and teach on current best practices. So that is often how we are doing ACRTI in practice. So if we're hosting meetings, we are making sure that there is language accommodations that our trainings offer, ASL, Spanish, other languages as needed, because we know that if we're modeling these things for programs, then hopefully they might be able to develop some of the same practices as well. I'm going to pause there, and David is going to speak to some of how our external ACRTI work shows up in our day-to-day work.
Lindsay, thanks so much. And just wanted to share, in this brief moment that, you all did the hard work. I think that what we did with our center and our practices and our training, our TA and the resource development was try to provide a container and then you all took that and ran with it. So I did want to shine a highlight on the video that you all made. And I think the link is posted, and then I'll turn it over to David. So David, if you could share with us some more details about the kinds of things that you all are doing, that would be great.
Thanks, Kathy. Yeah, I'm happy to. So, to kind of build on the work that we had done internally, the next steps kind of involved how do we not only get more involvement from other folks that are doing similar work to us, but also how do we bring this to our member programs and advocates? As Lindsay was talking about, a lot of this work started internally, and we realize the importance of us as the coalition modeling these things, and it starts with us. And so we are constantly talking about, hey, this is a great opportunity for us to practice this, so when we're training on it, it is real. This is not just something that we're a box that we're ticking. I think, as Lindsay had said, we have worked with our state's FIPSA funder, so that is DVP, the Domestic Violence Program in Colorado, and they have actually, that is now a requirement for their funded organizations, who are most of the service organizations in the state, to incorporate an ACRTI goal as in their program. And so we have become a technical support specifically for that, as well as the other pieces that we do. And we did notice that some of the organizations were struggling a bit to figure out, exactly what does this mean? What does this look like in practice for our organization? And that's where the ACRTI Foundations video kind of came from, was out of that, was we wanted to make something a bit more tangible, take a deeper dive. It's one thing to say, all right, here's this new acronym, this new phrase that we're going to use. It's another thing to do what we're doing now and do what we did through the ACRTI video and really talk about what it looks like in practice. And we really wanted to make sure that this wasn't something people, read once, filed away, and just moved on with. This wasn't a box that folks were looking to tick to make sure that their funding was secured, that this actually was something that came into the work. So part of how we as in Violence Free Colorado started that process was one of our colleagues, Miranda, who is our culturally responsive training and technical assistance manager now, started with a cohort. And so started connecting with member programs and basically allowed people to apply. If you think you have a skill in this area that you can bring to this cohort to help us all strengthen in our understanding and implementation of ACRTI principles, then you are welcome in our space. And we ended up having a cohort that consisted of folks representing 7 different organizations from across our state that met I believe every 2 weeks for a period of 6 months, helping to really look at what this framework meant, having these conversations as a group to figure out how to actually implement these things. Another thing that we've been really excited about and happened recently was an executive director retreat. So we actually had 27 programs represented at our executive director retreat. And it was an opportunity to come together and share experiences, provide support from both coalitions, the Domestic Violence Coalition, as well as the SA Coalition here in Colorado, CCASA. And the theme that we were talking about, and this is something that I've found myself talking about in a lot of trainings as well, is the idea that there is not necessarily such a thing as a safe environment. We are not able to create or determine something to be safe. So what are we doing to look at rather minimizing harm, to foster safer environments and promote safety, while acknowledging that that looks different for everyone? And that's not always the easiest thing. We really want to promote safety, and we want to believe that the spaces that we have created are inherently safe, but that's not necessarily the case. And so being able to come together and talk about that with folks doing the work. And as someone who was in direct service when ACRTI principles started becoming the norm, that was my introduction to it, was one of my supervisors saying, hey, that our DVP wants us to use this new concept of ACRTI, right? But the training and the foundation wasn't there at the time within our organization. And so what I have really enjoyed in my role as training and technical assistance specialist is a chance to connect with programs, to actually have these conversations one-on-one, to take advantage and leverage the trust that we have built with these member programs, the safety, the ability for us to be vulnerable and have conversations that allow folks to identify gaps maybe in knowledge, to connect with them and have these conversations. When we're developing trainings, you know, I recently did a training about mandated reporting, and the title was Mandated Reporting with an ACRTI Lens. I mean, we're incorporating it into the titles. This is not, again, not just something, hey, we'll cover what this acronym means through the course of the training. It's actually, this is what it means to be accessible in the process of mandated reporting. What is culturally responsive? What does cultural responsiveness look like in these contexts? And break it down. And I like to tell organizations, you are probably prioritizing these things already, but we are just wanting to make sure that it is a focus, that it's a lens that's brought into everything we do. How will this be experienced by folks with different backgrounds, different lived experiences, folks from different cultures, right? And have that be a piece that we actually actively incorporate into everything that we do. And we continue that all the time. That's a major part of what our training and technical assistance teams do, is just be present, you know, and accessible for folks to reach out and say, hey, we've noticed we're struggling in some of these areas. Can you come and provide a training? And we will come out to you. We'll come, you know, do a video. We do a webinar, you know, whatever is being identified. And especially when we're seeing themes that are popping up across multiple organizations, that helps us go, okay, maybe we're just going to host a statewide webinar on this and not wait for people to come to us. We're seeing these themes. So that's some of how it's looked for us in practice, and how we built on what we started internally to incorporate these things with our member programs.
Thank you so much, David and Lindsay. And I'm wondering, Carla, if there are any questions in the chat for us or for any of the panelists?
Not yet.
All right. So if anyone does have any questions, we have just a couple of minutes to respond if you'd like. And also, Carla, could you put up the links to the rest of the resources that we've been talking about? That would be great to have as well. So what I would offer from the experiences between the National Center on Domestic Violence, Trauma, and Mental Health and the New Jersey Coalition and Programs and Violence Free Colorado and the work that you all are doing, it's, as I was saying earlier, you're creating this container. So the framework offers us that. It offers an opportunity to say, when we focus on these things, when we have a lens that says, we can't forget that trauma happens, because trauma does impact how each of us shows up, that we have a lens that says, let's look at the ways that survivors really experience trauma and how those experiences interfere with approaches to advocacy, with approaches to healing, with approaches to getting the resources and supports that folks need. So we look at the ways that folks seeking services are impacted, and then how do we, in the work that we do, consider that there are approaches that we use that can make survivors' experiences so much better, so much more effective, so much more connected, that foster that sense of belonging, or we can not do that. And when we don't pay attention to all of those pieces, what we're learning is that survivors are often more discouraged, feel less supported. So thinking about ways that we can adjust our own approaches to the work, adjust our frameworks, adjust the way we think about and offer the supports that we have in place, it changes things for people. And so really wanting to encourage everyone to access the resources, to reach out to us if we can be a support to your work moving forward, thinking about, again, this notion of being accessible, culturally responsive, and trauma informed, and how that can come alive based on what individuals who are creative and committed and organizations that are willing to take that reflection and recognize we have some spaces to grow. So we can transform our advocacy, we can transform survivors' experiences. Right. So I see there is one question about how can we stay in contact with all the panelists? And so we will be sending out the slides from today and the biographies for all the panelists. We will also make sure that folks have access to any of the resources that came up today. And we will also have the social media handles for all of our panelist organizations. So we will give folks lots of opportunities to look at information and also to be able to access the folks that you were introduced to today. And I see there's one other question about, did we create or look for cohorts? So one of the things we did at the National Center on Domestic Violence, Trauma, and Mental Health is several years ago, I believe it was 2019 that we started, we did have a cohort of groups across the state. I think we had 8 or 9 organizations, or 8 or 9 groups, and with each group made both the coalition from that state and member programs. So early on, that was part of our listening and learning and then dissemination strategies. And the organizations that participated in that are listed in some of our resources that are available on our website. So you'll be able to check it out that way. In Colorado, I know that as Lindsay was sharing and as David was sharing, there was a cohort involved in some of their work. And so it's something that we encourage, within the state for folks to do, is to form cohorts for learning and growing together. So we are right at the end of our time, and I'm going to ask Carla if she would close us out.
Thank you so much, Kathy, and thank you to our wonderful presenters and for everyone who joined us today. Many thanks to our interpreters. We appreciate you being here for us and supporting our work. And as I put in the chat, we will be sending out a certificate, a link to the webinar recording, slides, the resources shared here, and a link to the SurveyMonkey to let us know how we did today. So I appreciate everyone for coming today, and I hope you have a wonderful afternoon. Thank you so much.